So the other factor that needs to be taken into consideration is the duration of neutropenia. The longer the neutropenia, the higher the risk of infection. The first infection that we encounter is bacterial infections. Bacterial infections happen in a matter of hours and to days when you have neutropenia. Fungal infections happen when you have neutropenia for many days to weeks. Viral infections happen when you have cytopenia, which also includes lymphopenia, for weeks to months. So we do everything we can to try to minimize the duration of neutropenia and lymphopenia. So stem cell transplant helps to overcome dose-limiting toxicity of the marrow, just like we talked about, because marrow is the rate-limiting step. So when you give just chemotherapy without any other support, then you're going to kill the marrow after so much chemotherapy. Whereas when you give growth factor, we are able to give a slightly higher dose of chemotherapy because the growth factor recovers the normal marrow. But you still can only give so much. But when you do stem cell transplant, you can almost double or even increase the dose to 10 times what you would do normally when you give chemotherapy without stem cell transplant. So this is what we call a reduced intensity stem cell transplant. Here what happens is you have a recipient who has normal cells and leukemia cells, and you have a donor who is donating the donor cells. But you're only giving reduced intensity conditioning, so it doesn't eliminate all of the recipient cells, and the donor cells are given. What happens is the donor cells are normal cells, so they kind of have a battle with the recipient cells and kill the recipient cells and the leukemia cells. And when you start withdrawing immunosuppression, and if you need to, you can always give donor lymphocyte infusion. If you know that they didn't develop any graft versus host disease, you attain what is called complete donor chimerism. So initially at day 30 or so after transplant, they may have mixed chimerism, meaning recipient cells still noted. But as the days go by, you get what is called complete donor chimerism. So when do you use a reduced intensity regimen? You have to use it in elderly patients because they cannot tolerate myeloablative regimen. You can only use it in the setting of complete remission because they don't have any marrow ablating properties. So if you have somebody with residual leukemia, then it is not going to be as successful. The residual leukemia can recover before graft versus leukemia can take effect.